I'm going to talk about this brief transdiagnostic cognitive behavioral group treatment for mood and anxiety disorders. I will start by explaining what do we mean by brief. We mean a short-term, few session treatment. This treatment takes 6 sessions, can be delivered in 6 weeks or even 3 weeks, and each session is about 2 hours in length. Transdiagnostic means that patients are treated with across diagnosis, both depressive patients and patients with various types of anxiety disorders, social phobia, panic, etc. And it is delivered in groups, up to 30, even 40 patients in one group, compared to individual treatment. So this treatment, group treatment, protocol-based treatment is quite cost-effective, as you may understand. It has been delivered in the primary health care in Iceland, in the capital area, since 2005, and also in the west part of Iceland, or West Fjords, and in the East Fjords. It was developed at the University Hospital, the Landspítali, between 2002 and 2004, and has been changed a bit since then. We have done some outcome studies of this program, 2 PhD projects. Hafrún's project is nearly finished, and we have another project recently started. What we have been doing is trying to translate research into practice. At the beginning, when outpatient service was emphasized more at the hospital, 2001 and 2002, we realized increased demand in mental health services, outpatient mental health services. And cognitive behavioral treatment is well suited for outpatient services. So the treatment was developed really because of increased demand, more or less for pragmatic reasons rather than for theoretical reasons. But we used theory, of course, and we used previous research to make this program. And it is made from various types of specific programs that deal with depression and specific anxiety disorders. But we put together the common elements in these various programs, and therefore we call it transdiagnostic. And we have done outcome research, and we have tried to change the treatment according to our results. These are the main results, just to give you a glance of what we have been doing. The treatment seems to work equally well for general symptoms and diagnostic specific symptoms. You see, we have simple psychological scale to measure specific symptoms, as I told you, social phobia, anxiety, etc., and anxiety in general, generalized anxiety and depression. And all the patients in these studies are those who are diagnosed, formally diagnosed with a psychiatric interview. If we compare the specific scales who measure change in symptoms for patients who are diagnosed with depression, with panic, with anxiety, generalized anxiety, and social phobia, we see that the difference between pre- and post-measures is quite significant. So both patients with general symptoms and patients with specific symptoms, they get better, a lot better. This came, in fact, as a surprise. We were optimistic, but not as optimistic as we have realized that the program can do. We have compared it to results from a huge or large study in England, which has the name Increased Access to Psychological Therapies. Both this government and the previous government of England, they have put a lot of money, millions of pounds, into increasing access to psychological therapies in England. And in our study, we found recovery rate nearly as high as in these studies. And recovery rate means that people get real better. They are symptomatic when they start, and they are not symptomatic when they leave treatment. And the study in England, they deliver individual treatment and specific treatment. Patients with depression, they get treatment which is specially intended for depression and so on. So we are very pleased with our results. We have then clear evidence that treatment can be transdiagnostic, and we wondered why or how this happens, and it's mainly because the patients, they learn from the transdiagnostic treatment how to cope with specific symptoms. Thank you.